Hello and welcome back to the channel where we talk about health, life, and well-being honestly and openly. Today, we're covering a topic that's close to the hearts of millions of women around the world: pregnancy after 35. Maybe you're planning to start a family a little later in life. Maybe you've heard scary things and you're not sure what's true. Or maybe you just want to be informed and prepared. Whatever your reason, you're in the right place. In the next 10 minutes, we'll talk about real risks, bust common myths, and give you practical, healthy tips that can make all the difference. So, take a deep breath and let's begin. First, let's understand a term you may have heard: advanced maternal age, or AMA. Medically, this term is used when a woman is 35 years or older at the time of delivery. You may have also heard the older term geriatric pregnancy. But don't worry, doctors today prefer the kinder, more accurate term AMA. Here's an important fact: millions of women successfully give birth after 35 every single year. In fact, the trend of later pregnancies has been rising globally for decades. So while there are some added considerations, being 35 plus does not mean pregnancy is impossible, dangerous, or something to be ashamed of. It simply means you and your doctor will want to be a little more prepared. And that's exactly what this video is here to help with. Let's talk about the real risks, and I want to be honest without being alarming. As a woman gets older, her eggs age with her. This can affect fertility and increase the chance of certain complications. Here are the key ones to know. Number 1, chromosomal abnormalities. The risk of conditions like Down syndrome does increase with age. At 35, the risk is roughly 1 in 350. At 40, it's about 1 in 100. These numbers are real, but they also mean the vast majority of babies are born healthy. Number 2, miscarriage. The risk of miscarriage is higher after 35, primarily due to egg quality. This is emotionally difficult to discuss, but important to know so women can get proper support. Number 3, gestational diabetes and high blood pressure. Both are more common in older pregnancies, but, and this is key, both are manageable with proper prenatal care. Number 4, C-section delivery. Older mothers are statistically more likely to deliver via cesarean section. Number 5, premature birth or low birth weight. Slightly higher risk, which is why regular checkups are so important. The takeaway is, these risks are real but manageable. With good prenatal care, healthy habits, and awareness, most women over 35 have perfectly healthy pregnancies. Myth number 1: you can't get pregnant naturally after 35. The truth is, many women conceive naturally well into their late 30s and even 40s. Fertility does decline gradually, but it doesn't disappear at 35. Myth number 2, your baby will definitely have health problems. The truth is, the majority of babies born to mothers over 35 are completely healthy. Risks are elevated, not certain. Myth number 3, it's too dangerous, you should avoid it. The truth is, with proper medical care, millions of women over 35 have safe, healthy pregnancies every year. Myth number 4, you're too old to handle pregnancy physically. The truth is, many women in their late 30s are healthier, fitter, and more financially and emotionally stable than in their 20s. Age brings wisdom and readiness too. Myth number 5, if you're over 35 and pregnant, you'll automatically need IVF. The truth is, most women over 35 do not need assisted reproduction. IVF is only recommended when natural conception doesn't occur after a period of trying. Remember, myths are based on fear. Facts are based on science. Always choose facts. Broccoli tip number 1, eat a nutrient-rich diet. Focus on folate-rich foods like leafy greens, lentils, and fortified cereals. Folate is especially important in early pregnancy to prevent neural tube defects. Also, prioritize calcium, iron, and omega-3 fatty acids. Pill tip number 2, take prenatal vitamins. Start taking folic acid supplements even before conception if possible. Your doctor can recommend the right prenatal vitamin for your needs. Running tip number 3. Stay physically active. Gentle exercise like walking, swimming, or prenatal yoga keeps your body strong, reduces gestational diabetes risk, and improves your mood. Always check with your doctor before starting or continuing any exercise routine. Number 4. Avoid harmful substances. Smoking, alcohol, and recreational drugs are harmful at any age, but especially after 35. Cut these out completely during pregnancy. Number 5. Prioritize rest and sleep. Your body is doing extraordinary work. Rest is not laziness, it's essential medicine. Aim for 7 to 9 hours of quality sleep. Number 6. Attend all prenatal appointments. This is perhaps the most important tip. Regular checkups allow your doctor to monitor both you and your baby and catch any issues early. One of the biggest advantages of modern medicine is that we have excellent screening tools for pregnant women, especially after 35. Here are the key tests your doctor may recommend. Number 1. Non-invasive prenatal testing, or NIPT. It's a blood test that checks for chromosomal conditions like Down syndrome. It's safe, accurate, and available as early as 10 weeks. Number 2. First trimester screening. Combines a blood test and an ultrasound called a nuchal translucency scan to assess risk of chromosomal abnormalities. Number 3. Anatomy ultrasound at 20 weeks. A detailed scan of your baby's development. Number 4. Glucose tolerance test. Screens for gestational diabetes, typically done between 24 and 28 weeks. Number 5. Amniocentesis or CVS if needed. These are more diagnostic tests offered if screening results suggest a higher risk. They come with a small risk and are only recommended in specific cases. Knowledge is power. These tests don't cause problems. They help you be prepared and make informed decisions. Pregnancy is not just physical, it's deeply emotional. And for women over 35, there can be extra emotional weight. Pressure from society, anxiety about risks, or worrying about what others think. Here's what we want to say to you. Your feelings are valid. It's okay to feel nervous and excited at the same time. Seek community. Connect with other women who have experienced late pregnancy. Their stories can be incredibly reassuring. Talk to a counselor or therapist if needed. Mental health during pregnancy matters just as much as physical health. You are not too old. You are not doing something wrong. You are a woman making a beautiful, brave choice, and you deserve every support along the way. In summary, advanced maternal age is a medical term, not a warning sign of failure. There are real risks after 35, but they are manageable with proper care. Many common fears are myths, not supported by modern science. Nutrition, lifestyle, and prenatal care make a huge difference. Important screenings are available to keep you and your baby safe. Your emotional health matters just as much as your physical health. If this video helped you, please like and share it, because someone you know might need this information today. Subscribe to Social Welfare Community for more honest, helpful content on health, well-being, and social awareness. And leave a comment below. We read every single one. Take care of yourself. You deserve it. Until next time, stay informed, stay strong, and stay well.